Now let's talk about something very, very difficult to treat or difficult to handle or clinically very relevant for us. Hepatitis B, D and C. Now D and B coexist. So we'll not discuss D because it cannot independently exist. If at all it is appearing with B. So let's discuss hepatitis B. This virus, hepatitis B virus, was very, what I can say is clinically virulent. Virulent is very florid, causes jaundice after getting inoculated into the system, may cause some symptoms between 4 weeks to 3 months. What will the patient present with? Typically with yellow sclera, yellow urine, or skin itching and yellow. But why did a person get it at all? Could be because blood transfusion, could be because needle contamination, seen very frequently in drug addicts, seen very frequently in people who take lots of injections in the not so very well known clinics where it is not run by professional doctors, very much known among those who share the GRBS needle, that is blood sugar testing small needle, that which punctures. If 2 people are using it to save money, it is known to transmit. All you need is 0.05 ml of the blood to cause this. Even a splatter into your eyes, suppose the blood splatters into your eye, that can cause hepatitis B. It's a very sensitive virus. Once gain entry, it multiplies very fast. Which are the other places? Dentistry, where if a particular dental clinic is not managing or maintaining good sterilization practice, somebody has plucked a tooth or done some drilling and then next patient comes, he uses the same without changing the drill, without boiling any of those instruments. Hepatitis B is very common among the dental clinics, and across UK, many dentists have been prosecuted for giving hepatitis B. Most of the doctors, or 2-3 doctors, which is very well documented in your Google, had hepatitis B themselves, and while treating have given the disease to most of their patients. Coming to hepatitis C. As I said, delta always goes with B. If somebody has B, you can check for delta and make it negative. Now, having delta or D along with B can be equally bad. The progress is very bad. They go into liver failure much earlier than the hepatitis B single disease. Hepatitis C is again another topic to discuss because this is also similar to hepatitis B when it comes to inoculation. Again, sexually transmitted, blood products are transmitted, surgically can be transmitted. Only thing is the incidence is low. For every 1,000, 0.3 can be positive for hepatitis C so far in the national data. While hepatitis B, for every 1,000 there were 33 patients, so it is quite high when it comes to hepatitis B. So Hep C being rare is also a bad disease because it is more virulent or more infectious, bad clinical progress compared to hepatitis B. Cirrhosis is much earlier. There I said 10% might go into cirrhosis. Here maybe 40% or 20% may go into cirrhosis. And I think the progression of disease itself is pretty bad, and patient might end up with more complications in hepatitis C than in hepatitis B. These are the blood-borne diseases.